Let's talk about the unfettered power that Daniel Andrews is trying to go for, and we'll see what happens with the upper house. Patrick Murrell talks about the attempts at a blank cheque for the Chief Medical Officer to decide when you can and can't leave your house in Victoria.
A chorus of crossbenchers are opposing the 12-month extension, joining the Liberals in calling for further scrutiny.
If the state of emergency gets renewed in 4-week blocks, I have no problem with saying, you know what, Parliament should be sitting at least once a month. It's the least we can do. It's what we get elected to do.
Well, we'll see what the Parliament delivers. Again, we negotiate in good faith with each and every member of the crossbench.
The current state of emergency expires on the 13th of September.
Nicholas Rees, will give you a chance to talk about Trump a little bit later in the show because I'm sure you have much, quote-unquote, fact-checking to be done. But give me the case as to why Daniel Andrews deserves a 12-month unfettered blank cheque when it comes to his own power and the Chief Medical Officer to be able, with no methodology and publishing that methodology, keep you in your house.
Look, can I begin by acknowledging that I think it has been confronting for a lot of people to hear that the Victorian government is seeking a 12-month extension to the state of emergency. But I do think once you drill down into it and understand what it actually means, it's fairly benign. I mean, what this does is give the Chief Health Officer the power to make the necessary health interventions to keep Australians or Victorians safe. So it means that the Chief Health Officer can do things like require people to wear masks, require people who have contracted COVID-19 to self-isolate, require that in certain areas, certain population density needs to be maintained. And instead of it taking months for those sort of decisions to be enacted, they can be done in a day, which is the sort of decisive action you do need, the sort of powers you do need when you're trying to battle a pandemic. So there's a lot of misinformation being peddled on this for highly partisan reasons, I should say. You know, people suggesting that somehow this means that the lockdown laws are going to be extended for longer or that the restrictions are going to be dialed up. It means none of those things.
OK, well, can I read an explainer about this legislation from the far right-wing news site abc.net.au, OK? Among the powers it provides is it allows Professor Sutton to direct health officials to detain people, search premises without a warrant and force people or areas into lockdown if it is considered necessary to protect public health. Mark, look, I believe that at the very least they're going to get this sort of month-by-month extension system. Do you think it's an ambered claim for Andrews going for the 12 months, so we can negotiate it down to 3 months?
Well, he doesn't need 12 months. The reality is, Paul, that Australia's done fairly well in containing the infections compared to countries overseas, but we're at the point now, 7 months into the virus being in Australia, where surely the strategy should be learning to live with the circumstances, learning to live, of course, with the hand hygiene, the social distancing, and most importantly, protecting the elderly, to quarantine and keep them away from the virus as much as possible, while also recognising that as we learn to live with the virus, the economy needs to grow. We need to create jobs. We can't have mass unemployment where many more people die because of the health consequences of recession than the virus itself. So none of that requires martial law powers. These martial law powers play into what I call the dictatorship of the health bureaucrats, that these unelected people, with politicians too scared to defy their advice, are pretty well running the country. And every health bureaucrat will always tell you, put the health lockdown first and the unemployed are dispensable. You know, we're creating mass unemployment. There's no economic recovery plan. The unemployed are being thrown overboard here, and quite frankly, that's a bigger health problem than the virus we're trying to combat. So martial law powers early on, of course, but as you learn to live with the virus, they're not needed, and the Parliament should sit and have accountable democratic government.
Yeah, Rita, I mean, again, it was pretty brazen of Andrews to turn around and say, I want another 12 months, but I'm not going to tell you the system about how many cases for how many days trigger this, that and the other, and conversely, on the other way out, part of the reason why they were able to, or they were forced into lifting things the first time around, was because flatten the curve was what we were going with. Nobody says flatten the curve the second time around. And despite the fact that Sutton this week said 50 cases a day is probably manageable, we don't know that that's the actual margin to get you out of curfew.
No, we don't know any of the modelling. We don't know any of the measures they use to decide when stage 3 becomes appropriate, when stage 2. You know, for Nicholas to say this is just some sort of procedural thing, we can't just keep plunging the state into a state of emergency every time there is an outbreak. Are we going to keep doing that for the next 2 years, 3 years, 4 years until there's a vaccine? If there's a vaccine, you need to learn to live with this virus as other parts of the country and other parts of the world have done. Victoria doesn't seem to have come to terms with that. And I think Australia hasn't totally come to terms with that either. I know other states are doing much better than Victoria at the moment, but I wouldn't be surprised if they have a outbreak somewhere that they wouldn't overreact and completely destroy the joint to try to contain a virus, which until there is an effective vaccine is never going to be completely eliminated. And we seem to have adopted an elimination strategy without explicitly saying so.
Nick, would you not agree that there has to be clearly defined this many cases, this many days equals this, this and this?
Well, can I start by saying that, and I've said this many times before, but Mark Latham is a very, very intelligent chap. But sitting as he does in the New South Wales Parliament, I don't think he's across the detail of actually what's happening here in Victoria. So when he talks about martial law, he'd be referring there to what's known as a state of disaster. That's when the police minister and the police commissioner get extraordinary powers.
You can't leave your house after 8 o'clock at night.
Disaster here in Victoria, but you can only be in that state under our current laws for a month. What Daniel Andrews is talking about here is a state of emergency, and that goes to the powers of the Chief Health Officer around things like wearing of masks, people being required to stay at home if they've got coronavirus. So it's a very different proposition. So I just wanted to clear that up. In terms of what's the magic number, Paul, you know, and it's a question everyone asks, you know, at what number will we get down to when we can say, OK, now we can lift the restrictions? I actually think that's the wrong focus. I think we should actually be focusing on the testing times and the contact tracing process. So, you know, and I'm going to say in Victoria at the moment, I think it's taking too long to do those things. So, you know, if you go and get a coronavirus test, they should be back to you within 24 hours. Not 3 days. If you test positive, there should be a contact tracer on the phone to you within an hour, not another 3 days. At the moment, you've got a situation where people are going for 6 days with coronavirus before they're actually getting a call from someone from the health department saying, excuse me, you've got to stay home and here's all these other things you must now do. And so if we can get that process going much better, then I think the state's in a much stronger position to be able to have the discussion about, OK, let's start lifting some of these restrictions. Because we can handle it now.
Look, Mark, while you might be 1,000 kilometres away from Nick, I know the internet cable doesn't extend that far. I know you don't get any news and you're only sort of roughly hearing things via misinformation. What do you mean by martial law?
Well, unlike Nick, I went through a martial law debate here in the New South Wales Parliament in March when we gave these extraordinary powers to the Berejiklian government, and Labor said it was martial law, the Greens said it was martial law. One Nation said it was martial law. Behind the scenes, the government agreed these are martial law powers. They're the powers to lock down businesses, in Victoria's case, to have a night curfew, to lock people in their homes, to restrict freedoms. You said the Chief Health Officer would have the power to detain people. These are martial law powers. It doesn't really matter what you call them. That's what they are. And to pretend otherwise is sort of just, you're trying to put some lipstick on a pig.